There's a question I hear constantly from men searching for answers online, a question that reflects a deep vulnerability many feel about their bodies. It's about size, confidence, and the lengths people will go to feel secure. And today we're going to talk honestly about one specific technique that's been circulating online for years. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today's topic is Jelqing, a manual stretching technique that's become incredibly popular on the internet. But before you watch one more tutorial video or believe another before and after testimonial, I want you to hear the medical truth about what this practice actually does to your body. If you've spent any time searching for ways to enhance penile size, you've almost certainly come across Jelqing. It's everywhere. Hundreds of videos, articles, forums, and communities dedicated to teaching and discussing this technique. So what exactly is Jelqing? Jelqing is a manual exercise where someone uses their thumb and forefinger to form a grip around the base of a semi-erect penis. Then, with consistent pressure, they stroke upward from the base toward the head, essentially milking the penis in repeated motions. The sessions can last anywhere from several minutes to much longer, depending on the routine someone follows. The theory behind this practice goes something like this. By repeatedly stretching penile tissue, you create microscopic tears in the cellular structure. The body then repairs those tears, and in doing so, supposedly creates new tissue or expands existing tissue, leading to increased length or girth over time. Another idea behind Jelqing is that it might improve blood flow to the penis, which some believe could enhance erection quality or size. It sounds logical on the surface, right? Stretch, repair, grow. Simple. But here's where we need to pause and ask the critical question. Does this actually work? And more importantly, is it safe? The honest answer is that we don't have strong scientific evidence supporting Jelqing as an effective method for penile enhancement. There was one very small study conducted by a company that manufactures penile pumps. They examined 7 men who practiced Jelqing exercises and found that the technique did not produce any measurable increase in penile length. But this study was so limited in scope and so tied to a commercial interest that we can't draw meaningful conclusions from it. Beyond that single flawed study, there's essentially no rigorous clinical research demonstrating that Jelqing works. No peer-reviewed trials, no large-scale data, no validated protocols. What we do have, however, is something much more concerning. Documented cases of harm. This is where the conversation becomes serious, and I want you to listen closely, because the risks associated with Jelqing are not theoretical. They're real, and they've happened to real patients. When you repeatedly stretch and manipulate penile tissue with force, several types of injury can occur: nerve damage and numbness. The penis contains delicate nerve pathways that are responsible for sensation and sexual pleasure. Repeated trauma from aggressive stretching can damage these nerves, leading to reduced sensitivity or even permanent numbness. Imagine losing the very sensation that makes intimacy enjoyable, all in pursuit of a size change that may never come. Vascular injury and erectile dysfunction. The blood vessels in the penis, the arteries that bring blood in, and the veins that control blood retention are incredibly important for healthy erections. Jelqing can injure these vessels. When that happens, the normal process of blood flow during arousal becomes disrupted. One study examined 37 men over an 11-year period who visited a urology clinic specifically because they developed erectile dysfunction after practicing Jelqing. When these men underwent ultrasound imaging of their penile blood flow, doctors found what's called veno-occlusive dysfunction, a condition where the veins fail to properly trap blood in the erectile tissue. Without that mechanism, maintaining an erection becomes difficult or impossible. Think about that. 37 men sought medical help because a technique meant to improve their sexual confidence had stolen their ability to have erections. Bruising, pain, and skin irritation. Even in cases where permanent damage doesn't occur, many men experience bruising, swelling, skin irritation, and pain. These symptoms can persist and interfere with sexual activity, comfort, and quality of life. Penile deformity. Another study looked at 3 men with different unconventional masturbation practices. One practiced prone masturbation, another used hot tub jets for stimulation, and the third was performing Jelqing exercises. All 3 underwent Doppler ultrasound imaging, which revealed structural injury to penile tissue. The man who had been Jelqing didn't just develop erectile dysfunction, he also developed a visible penile deformity. His penis had changed shape. This is not a minor side effect. This is a permanent alteration to the structure of his body. Let me be clear, these are not isolated incidents. These are patterns we see in urology clinics around the world. And the heartbreaking part is that these injuries are often the result of desperation. Men who felt insecure, who believed the promises they saw online, and who thought they were taking control of their health. I understand the desire to feel more confident in your body. I understand the vulnerability that comes with concerns about size, especially in a world where unrealistic standards are constantly reinforced by media and pornography. But I need you to hear this. Your worth is not determined by the size of your penis. And more importantly, risking permanent harm to your body in pursuit of an unproven technique is not the answer. If you're genuinely distressed about penile size, the first step is to understand what's actually normal. The average erect penile length is approximately 5.2 inches, and there's a wide range of normal variation. Concerns about size are incredibly common, but in the vast majority of cases, what someone perceives as abnormally small is actually well within the normal range. If anxiety about size is affecting your quality of life, mental health support can be transformative. Body dysmorphic concerns, sometimes called small penis anxiety, are real and deserving of compassionate care. Speaking with a therapist or counselor who understands sexual health can help you process these feelings in a healthy way. And if you're still interested in medically supported options for penile enhancement, there are evidence-based approaches. For example, penile traction devices have some limited research suggesting modest gains in length when used consistently over many months. But even these come with their own considerations and risks. What I will not recommend is Jelqing. The potential for serious, irreversible injury far outweighs any unproven benefit. If you care about your sexual health, your sensation, your ability to have erections, and your overall well-being, please do not engage in this practice. It's not worth a lifetime of regret, numbness, dysfunction, or deformity. I share this information not to shame anyone, but to protect you. I've spent my career caring for people who come to me with urological concerns, and I've seen firsthand the pain that comes from well-intentioned but harmful practices. Your body deserves care, not force. Your confidence deserves truth, not false promises. And your health is worth protecting, even when it means letting go of a technique that once seemed like hope. If you have concerns about your sexual health, your anatomy, or your confidence, please reach out to a urologist or healthcare provider you trust. We're here to listen, to guide, and to help you navigate these concerns with dignity and evidence. Thank you for being here, for listening, and for taking your health seriously. If you found this helpful, please share it with someone who might need to hear it. And as always, remember to take care of yourself because you're worth it.